Australia is a first world country, but for Aboriginal and Torres Strait Islander people, we have third world health conditions and a significant health inequality compared to other Australians. The World Health Organization promotes Indigenous primary health workers as leaders in addressing health inequality. And here in Australia, this workforce is gaining strength. Aboriginal and Torres Strait Islander health workers belong to a unique profession, one which truly reflects the Aboriginal and Torres Strait Islander view of health. That is, not just physical health, but the spiritual, emotional and cultural well-being of the whole community. Aboriginal and Torres Strait Islander health workers are critical if we are to close the health gap. They are highly trained and highly skilled, and like other health professionals, they have a clear set of professional standards. They deliver clinical services, health promotion and case management, and work with their communities responding to local health priorities. They're also challenging the rest of Australia to reconsider our understanding of healthcare and to see the need for a holistic and culturally safe approach. In this program, you'll meet Aboriginal and Torres Strait Islander health workers who are making a real difference to the spiritual, emotional and cultural well-being of their people. Wuchopperen Health Service is an Aboriginal and Torres Strait Islander community-controlled organisation in Cairns. It started 31 years ago and now employs over 180 people. Health workers in Wuchopperen are the first contact point for Aboriginal clients and perform a vital care coordination role.
Aboriginal and Torres Strait Islander health focuses on a family, an individual and a community in a holistic way. So it looks not just at being someone being ill or physically ill, it looks at their whole well-being, so their social and emotional, cultural, spiritual well-being and how that impacts on someone's health.
Just like to see our doctor, please.
Every client seen at Wuchopperen here in the medical clinic is seen initially by a health worker.
There you go.
And we call it screening, but it's much, much more than that.
Hi Noel, my name's Bruce, I'm one of the health workers here. What can we do for you today?
I was just asked to come in for some checks, some tests, blood tests and that, to see if I'm diabetic or not.
Oh, no worries, we'll check your blood pressure and blood sugar and your weight.
There's the gathering of medical data, but there's also the gathering of information. Often that information is, shall we say, more subtle or more private or more culturally appropriate than would be perhaps understood by a non-Indigenous caregiver.
A bit up today. Just jump on the scales here.
All right.
Well, I got his story from him and why he wanted to see the doctor, and I also discussed with him what else we can do for him, what other services we can offer. So it's a good idea to get checked.
Wuchopperen has always believed that the health workers are front and centre to healthcare. They tend to be the first person to speak to the client. They're also the first person that the clients will turn to if there's some confusion or they need further clarification and so on. And then in our model here, they're also the last person that they speak to because they're the people that are organising their follow-up and their transport and their recalls.
Do you have any family history of diabetes?
I've no idea.
There's a good chance you do. I mean, Indigenous people do have a high rate of diabetes and things like high blood pressure. And I also noticed that you've been referred to a diabetes educator.
Oh, yeah?
Yeah.
When we go down to see the diabetes educator, will you be coming down?
Yeah, no worries, that's not a problem. Yeah.
But, you know, because I'm not sure what questions I should ask him.
No,
that's okay?
Yeah, that's fine.
Yeah, good.
So, Noel, what do you know about diabetes?
Not much at all, mate.
Okay.
Yeah, I know it's no good for you, but...
Yeah, it's no good. Yeah, well, Bruce would often accompany the client for the first visit.
So, Tony, how could Noel reduce his risk factors?
Yeah, well, there are a couple of things. We have a look at diet and his activity level. See what sort of exercise or...
It gets a bit hard, especially with the job I do.
Yeah, for sure. What you...
Sit behind on a desk now, mate.
Yeah.
Not sitting.
Yep.
Yeah.
You get clients who come in and they might go and see one of the allied health professionals by themselves, and next time you see that patient, they're going, oh, I didn't know what that bloke was talking about. How come he was sitting so close to me and, you know, he was invading my space? The health worker can help put both people at ease and make them comfortable to prevent any misunderstandings. And
Noel, you seem pretty open to some lifestyle changes.
Oh, yeah.
Yeah.
Depends how serious they are.
Yeah. And Bruce is probably the man to coordinate that with the dietitian and the non-smoking team.
Yeah, no worries.
Bruce?
I'll take Noel down to make some appointments to see the dietitian.
I came to a Metropolitan Health Service because it's an Indigenous service, and because I feel more comfortable coming here.
Good morning. Good morning, Vicky. Noel needs to make appointments with the dietitian and the optometrist. If we can do that, please.
Oh, come in. How are you?
Morning. We work as a team here. I organised a meeting with Marion and Marlon because I did have some concerns in regards to Noel's social and emotional well-being. Thank you. Because he did state to me when he was leaving that he did have some issues. He's recently had a loss in his family and he's worried that he's started turning to alcohol to help deal with it.
When Bruce came and spoke to me in my office today, we brought another person from the social and emotional area in as well on the interview. Do you think that maybe some of your services over there can help him with his his loss and his alcohol problem?
We can get him involved with the counselling and support and substance misuse programs and plenty of other programs around healthy relationships if he has any problems at home.
You happy with that?
Yeah.
That'd be great.
So we did a case study on a client that he saw, and the client needed some more referrals onto allied health people. Well, that was just basically a really, really good case of what happens here. You know, like that's where the holistic approach and the cultural wellbeing and everything like that comes into place as well.
I'll start off. You tend to pick up on people's attitudes and their emotional state, and if you can do that, then you can go a long way towards helping them. I've been doing this for 17 years now, and it's been good. It's been an interesting journey. All in all, it's been a good experience and made me a better person. Yeah.
Flinders Medical Centre in Adelaide is a major teaching hospital. Within its Karpanaratendi Aboriginal Health Unit, the hospital liaison officers are all qualified health workers, for whom liaison is only a part of their role. They use their clinical knowledge to improve health literacy of Aboriginal patients and the cultural sensitivity of the mainstream hospital environment.
It's a big thing coming down to a hospital if you've never left your community.
I'm going up to see Natalie. Okay. Our job is to look after the Aboriginal patients, but also advocate on their behalf, because Aboriginal people are very shy people. You know, we don't like to look at people, we don't like to talk to non-Indigenous people, especially in a hospital like doctors and nurses. So Aboriginal health workers are very important. I'm here to see Natalie.
Yeah, she's in bed number 9.
Thank you. Problem with your heart. So did you have that procedure yesterday?
No, today. When they're in the hospital, then the liaison workers visit them on the wards and then liaise with doctors and nurses about cultural aspects that they might need to think about.
Now you're going to have your angiogram, artery. Okay.
Today.
Okay.
I came down for this.
Yes. Do the angio, maybe put a stent, put the balloon. Yeah. I was just letting her know what sort of procedure she was having, whether she understood what she was having and whether she was happy about having it. And then you'll fly home after 5 days.
After 5 days?
After 5 days, after the stent, yeah.
After the
So you've done really well, Natalie, because I remember you wanted to go home the first day you came here. I'm passionate about this job because Aboriginal people die, 17 to 18 years before non-Indigenous people. I just want to make a difference, even if it's a small difference.
So I think they'll keep it one more night, probably when the bed's ready tomorrow.
Well, a lot of the nursing staff, the doctors, their knowledge of Aboriginal culture is limited, and a lot of the staff here don't realise that some of these patients coming from their community is their first time leaving their community. And I see those patients coming with a lot of fear, shame job, they're very scared. Hey, Russ, how you going, all right? Are you going good? So you end up having that thing yesterday, that procedure yesterday, and just talking to the nurse there now, looking at possibly discharge today. So I'll find you accommodation at one of the Aboriginal hostels. What I had to do was get Sue, one of the nurses, involved to talk to Ronald about the discharge process. She'll go through the education pack with you and explain everything so you understand what to do from now on to really look after yourself.
After a stent, you'll be on medicines for the rest of your life. Need to take these every day. If you're not taking your medicines, there's a good chance your stent will block up. Aboriginal liaison officers are a great resource as far as cultural learning. We've had them giving in-service sessions to nurses on the ward.
We have a greater role in the training of non-Aboriginal workers in understanding the cultural elements of what you might need to think about as having an Aboriginal patient, hence the need for Aboriginal health workers within hospitals.
If there's any questions that you want to say now. During the talk with Sue, I felt that Ronald was saying yes a lot. A lot of our patients will say yep, 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 and really I know that information's not sinking in. Yeah. I was able to get Ronald by himself and ask him how he felt after that information was given. Yeah, I think it was a little bit overloaded for him. So he was able to sit down with me and ask me some of the questions that he sort of missed.
Smoking business, smoking for a couple of months.
I can get in touch with a quit smoking worker back in the community and I'll organise for them to set up an appointment. You're going to have a lot more energy. You might be able to pull the boots out and have another kick on the footy field. Yeah.
The perception is that we are just aids, assistants, but we are really a profession in our own right, and the national registration actually justifies that and gives credence to that.
In the 6 years working in health now, I've obtained my Allied Health Certificate 3, Primary Health Certificate 3 and Primary Health Certificate 4. You can become a physiotherapist if you want, an audiologist, a dietitian, a podiatrist, and best of all, just being an Aboriginal health worker, helping our people.
Aboriginal and Torres Strait Islander health workers are also out in the community, developing relationships and delivering health promotion and education. In Adelaide, the Aboriginal Primary Health Unit at Noarlunga has been running a program for more than 10 years called Nunga Lunch. Outside of the usual medical setting, it's an opportunity for health workers to build connections and share information about health and health services.
We're a health organisation, so we promote healthy eating, physical activity, information about heart disease, diabetes, things like that.
Hello Lucy, it's Wakuna, how are you?
So Nunga Lunch, which we have every Wednesday, is about the community coming together to have good food.
Is your nana there?
A lot of our clients are isolated, so it gives them an opportunity to come in and mix with others.
It's Malcolm from Aboriginal Health. I was wondering if you'd like to come to Nunga Lunch today.
As a team, we'll set up and we will assist with the preparation, if needed, of the food. We'll do pickups, make phone calls, check out who wants to come to Nunga Lunch.
Anyone else have any to pick up?
No, I think we've got everyone.
Hey, it's Malcolm.
Yeah. Hey.
Bigby sorted that out for you?
Yeah. Well.
The reason why I got into Aboriginal health was because I got sick and tired of seeing family members and community members dying at young ages due to a lack of education and just not being aware of diseases and disabilities that they have.
The community members see the Nunga Lunch as a good social gathering, but it's also important for them to speak to the health workers and get information on some of their health issues, health information that they like to know about. So we promote that at all times. The whole team on a Wednesday are in attendance And that's an opportunity for the community also to touch base with the health workers.
What we do is we try and get in there, communicate, even have a laugh, you know, make them feel more welcome and give them as much information of what they need.
Oh, yeah.
Happy faces, people talking. The workers sitting down and chatting with the community to make them feel comfortable, let them know that we're there for them. It's a more relaxed environment. Some organisations might not feel welcoming to them. They may not be culturally appropriate. They feel shame, that's what they say, just shame. They just don't feel comfortable. We can help to ease that.
And it's amazing what will come out just in conversation.
Double pneumonia, got lung trouble, you know.
With Leonie, I found out that she'd been in hospital that we had no knowledge of.
And I realised I missed out on a lot of stuff by not coming in mixing with people, but now I've got a lot of cultural stuff's coming out.
I love my work, I love my job, because I've been there before with the drug and alcohol misuse. I've been on the receiving end of the service my program provides. I know what they may be thinking, feeling. Yeah, because I've been there, done that. Life skills does help me with my work.
You haven't been diagnosed with type 2, you've been diagnosed at risk of getting type 2.
Yeah, well...
I've known, even since I was in high school, that I wanted to be an Aboriginal health worker. I'd run health sessions and presentations on diabetes, heart disease.
Oh, that sounds good, Joel. I'd be really interested in that.
It is much more than a job for me. It's pretty much of a way of life.
I can just do a quick assessment of your teeth and give you a referral form to a dentist.
It makes me feel good being able to be there and provide a service to our community. I love that. I love making a difference.
I'm in the right job. It's a bonus to get paid for it.
Katherine is home to the Wollonjang Health Service, an Aboriginal community-controlled health organisation catering to Aboriginal residents of the Katherine area, as well as remote communities. All Aboriginal health workers employed at Worley are registered practitioners under the national scheme. Bachelor Institute provides the accredited course for Aboriginal and Torres Strait Islander health workers. And at Worley, the trainees have the benefit of being employed by the health service and having supervised training on the job.
The Trainee Aboriginal Health Practitioner model that we have here at Worley is quite unique in that we actually employ our trainees. We're looking at blood pressure today, so what's blood pressure?
Pressure of the blood in the heart and arteries.
Here we're training adults, so we're looking at adult learning. Adults bring to the training, to the course, their past experiences, past skills, transferable skills from other jobs and certificates that they've done. 90? Yeah, okay.
I was a pre-operator. Before that, just trucked along. The reason why I took up health work is I was sick of going to all my mates' funerals, Indigenous mates. In the last 3 years, I've been to about 20 funerals, mates that are younger than me, because I think the nerves are all gone. Working outside of health, you get all the negative feedback about the countrymen, and I thought, well, get in there and fix the problem, which is their health.
What might have happened in an acute situation?
Their blood pressure can go low if they're bleeding.
Our model here at Worley is that we have a training centre where we do theoretical and practical training, and then we go into the clinic.
122.
So they're getting a broad range of experience and a broad scope of practice, because that's what they have to be able to do at the end.
I should ask if a grandmother or auntie could come and consult, so they can help her at home, you know.
That's good.
You see examples like Letitia Jackson come in here as an 18-year-old. You see them grow, you know, right from day one, and then you see them stepping out there.
We should give her penicillin.
So the health workers can give penicillin injections, can't they? We can do that.
Should we do daily dressings here then? If families do. I've been a health worker for about 5 years. You just get more knowledge every day and you meet new people. that you didn't, and you lived in Katherine. And I feel like I'm giving back to my community, my family, my people, and looking after them. That's what I enjoy about it. Thank you. But I'm happy and I'm grateful I'm in a job that I want to be in, and that's what it is for me, just learning the different things and working with great people and the good teamwork and the communication. You've seen that she is diabetic?
Yeah.
So now what does Albert, he's in his second year of his training, so he kind of knows what to do.
Going by a chart there, it looks like... Yeah.
Normally what happens is we look at the patient's file first. So I go through with the trainees and ask them, like, what observations do you think we should be doing in this consult before they come in? So then when they are in the consult room, then Albert already knows what to do.
This way, Lee. Take a seat.
This is Albert, he's one of our trainees. Is that okay if he sits in this morning?
Yeah, that's fine.
Albert, can you start doing normal obs? Yeah. So we'll get her temperature, blood pressure, because she's...
I think we're better than the hospital, to be honest. I'll place this under their tongue. We screen them better than the hospitals and then put them out for the doctors to come in and see them then. The doctor's got a baseline for them then.
Then we've got the other side of it, which is the cultural brokerage. And that's a really important part as well, being able to meet the person and take time to sit with that person and get the full story and come up with a plan of care.
You said there was a stick there and it's just right there for Theresa.
Can you see him?
Yeah.
We'll have clients that live in the long grass. They haven't got access to showers. We will give them a shower at the back. We'll cook them breakfast and we will do whatever it takes to make them feel like they are special.
To be able to be cared for by someone, who understands and knows about and works within your cultural activities, life, whatever it is, that's very, very important.
Did you put that stick in there because it was itchy?
Yeah.
Yeah. We can relate to them because we are Indigenous, and we will make sure that they do savvy what the doctors tell them.
It's important that you don't put stick in your ear.
Sandy is the trainee health worker. They have to be supervised until they get registered to give them that little bit of experience and just to show her what we normally do. How to screen the client, introducing her and letting them know that she is a trainee and to get their permission and to get her to build that trust up and just to do what we do with them normally. Notice? Yeah. That's how you tell this young fella is a renal client. This is my 5th year that I've been registered. I was a cleaner, had nothing behind me, and I needed a trade to be able to support my children. It's a career. You always got the chance to move up, whereas a cleaner, I couldn't move anywhere. Just ask him if he's checked his sugar level today. But you can achieve anything that you set your mind to, and there is positive support up here, and that's why I have gone as far as what I have. And I hope to make a big difference in these mobs' lives.
Let me know if it hurts, okay?
We're just going to pull him out now, Gordon.
There.
Hey, too long.
That's...
Yeah, once they've graduated from this training program and they've gone into the clinic as autonomous clinical practitioners, then they're really seen as the leaders because they're looking after our people.
There is something that we have missed, but I'm testing you to see if you know. My vision, I want to become a leader, like I see myself as a role model now for my family and my friends and the young people back in my community, because I don't want them drinking grog all the time and under the bridge, down by the river. Because that makes me sad, that makes me, and I want to help them, and that's why I'm here, and I want them to see that if I can do it, they can do it too.
If we're going to close the health gap, it's vital that Aboriginal and Torres Strait Islander health workers are an integral part of the healthcare team and that their skills are used to the fullest. They are the link between the Western model of health services and the grassroots Aboriginal and Torres Strait Islander community. They have the clinical skills, the community connections, and the cultural knowledge to support the very best of modern medical interventions. Aboriginal and Torres Strait Islander health workers, truly a unique profession.